Hi guys, it's your girl Lady on PC here back again with another educational, motivational, and inspiring video. If you're new to this channel, please feel welcome. I am glad to have you, and I hope you'll find my content encouraging as much as it has been inspiring to me and to my subscribers. And to you, my subscribers, I appreciate you guys. Thank you so much for sharing my videos and for spreading the word about my channel. I appreciate you so much. All right, today is Monday. That means we are going to be learning medicine. For those who are not aware, I'm a medical student learning medicine, and I'm taking you with me. And I posted a question to the public asking what they would like me to talk about in my channel. And a lot of people showed like they had interest to learn about medicine. And so that's why I decided to start this series called Learning Medicine on Mondays. And because I launched it in March, and March being Women's History Month, we started talking about women's health. So the first video was on endometriosis. If you don't know what that is, please click the link up here and then go watch that video, then come back and watch this one, okay? And so today we are going to talk about a topic that also a lot of you have requested, and I think it's very important for us to be talking about it. And I do have special guests with me, so I'm gonna give them this opportunity to introduce themselves. Brianna, you can go first.
Thank you, Lydia. Thank you so much for having me again. I really appreciate the opportunity to get a chance to, one, be a part of your channel, but also get to learn some things. I think that the topic around women's health is so important. And so I appreciate you creating a platform and creating space for us to learn more. Thanks for having me.
Thank you so much. I appreciate that. Yeah, I want my channel to be a platform where if someone wants to learn about medical stuff, spiritual or relationship stuff, they can come. Yeah, because I feel like those three things are very important and they affect our life so much so. And that's why I like to talk about these topics on my channel. So thank you so much.
Of course.
Alrighty, Naomi.
Hi guys, it's Sister Naomi here, and I'm glad to be back. Thank you for having me, and I hope you have fun.
Good. We're going to have fun recording this video. And Naomi, I am so happy to have you back. I know people miss you. They miss our series on Ask Sister Naomi, where we talk about relationships. So hopefully we can see you more often.
Okay.
Anyway, thank you so much, Brianna and Naomi. I really appreciate this. I love you guys. Thank you for creating time to help me record this week's video on medical dots.
You're welcome.
Yeah. All right, guys. So today we are going to be talking about contraceptives. Yeah. Yeah. But some people messaged me asking about contraceptives, and you know how some people use emergency pill more often that they should use, I guess, just things like that. And people have questions. Naomi, you can talk about like the African culture or, contraceptives and all that stuff. Yeah.
All right. So I'll first of all start by saying this. Like, cultures are different. The topic is kind of a big topic to a lot of people. It's kind of sensitive. So personally, growing up, I didn't have this conversation with my mom. Mm-hmm. I did not at all. I think she expected that, the more I grow, I will learn by myself, I think. But honestly speaking, I feel like as parents, we should be able to have this conversation with our children, not only girls, even boys. We should have this honest conversation with them because you don't want them to get some misinformation from their friends who don't even know exactly, what's going on. Mm-hmm. So it's better to do your research as a parent and really at the right time have the conversation with your children.
Exactly. No, I like that you say that. And I find it so interesting because mom never shied away from talking to us about like sex and how to carry yourself well. But for some reason, she just didn't talk about contraceptives.
No way.
So that is a Kenyan culture. It's very different. And I'm happy we have Brianna today because Brianna was born and raised in America. And so Brianna, what's like the perception of contraceptives in America?
I think it varies. I think we'd all be surprised that, very much like what Naomi just described, there's probably some households and there's probably some, women whose mom also did did not share that there were alternatives out there, that I think a lot of times parents just don't want you to do it. They don't want you to do the thing that would require you to need a contraceptive.
Yes.
So I think that maybe the feeling is that if we don't tell you that there are alternatives, to protect yourself, then you just won't do it at all. So that the thought, or maybe the conversation varies in households. I was fortunate enough that my mom, when I got to college, my freshman year, she was like, okay, we're checking things off the list, and I'm also going to sign you up to see a gynecologist so that you can discuss with her birth control and what that means. And I was so nervous. I was like beet red. I was like, I cannot believe my mom is having this conversation with me. And it wasn't necessarily that I think that she went into great detail about what this meant, but more so she just wanted me to have a resource available if I decided that I wanted to be active in that way. I could protect myself and prevent, maybe a pregnancy that I wasn't quite ready for at that time. So I think it varies. I think I had a experience that kind of maybe set me up for the future, but I also think that there were probably additional details she could have shared that could have helped as well. But I think she did the best what she could. But I definitely think that there are other, not just, in African culture like Naomi described, but I also think in some households in the US and in America that this conversation doesn't happen either. And so, women are just Googling and, having conversations with their friends and trying to fact find in that way.
Yeah.
Brianna, I agree. I agree.
Yeah.
Good. And you've raised important points like I really want to touch base on. So for instance, like you're saying, girls are Googling out there. I just have to put it out there. Hey, that's why as a medical student who is learning these things, I feel like it's important for us to talk about these things so that people can have a reliable source of information. But of course, I have to be careful to put it out there. I am not a doctor again, and this is not medical advice. I'm just giving my perception as a medical student, and then I have my sisters here with me who can help me talk about it. But I think that was a very important point because it helps me then explain further why this channel, why these topics.
Yeah.
And also like the fact that you talked about like how in some households this is not talked about because they don't want to, they feel like they're going to encourage girls to get in sexual intercourse. And I like that point because today I'm hoping I can kill, quote unquote, that myth, because contraceptives are not just used for birth control. And hopefully by the end of this video, we will learn more about it. Yeah. So Naomi, given what Brianna said and what the mom did when she was going to college, you being a mother of two beautiful girls.
Thank you.
And they're almost getting to that point where you're going to have this conversation.
Yes.
How do you feel about it? Like, would you do it like your mommy did, or how would you do it differently?
Thank you, Lydia, for that question. I'll say this. I wouldn't do it as my mommy did because that's hard. That's hard. Finding out stuff on your own, not knowing whether you're doing the right thing or not. Personally, I'm prepared, honestly. I feel like once they reach their teenage years, I will definitely have that conversation with them. I will make sure I have the best. I've done my best research out there, gotten the best, because we have different kind of contraceptives. Remember, we have hormonal, which I didn't even know before. We have hormonal, we have oral, we have different kinds out there. So you have to, with the help of your doctor, you have to talk and see which one best fits. And for me, honestly, I don't think having that conversation will kind of make them go out there because it takes a lot too. I feel like while you're talking about that, you should be also talking about the consequences of premature sex, and for them to know really just by you having this contraceptive doesn't mean you're open to go out there and just do whatever you want. You never know, God forbid. Sometimes you might find yourself, the world we live in, maybe you get raped. You are not prepared. And then you carry unwanted pregnancy.
Exactly.
you know, things like that.
Mhm.
So yeah, so while you're having that conversation with the girls, like, you know, you should also let them know, like, the consequences of premature sex. You know, the consequences. So there's a lot involved. There's
Yeah.
a lot involved. Not only that, but there's a lot involved.
Definitely. But I see you feel like it's important to talk about these things as soon as it is possible. Okay.
I feel like once they're teenagers, you have to talk about it, because remember, their teenage friends or their teenage mates will be out. Some of them already know the information.
Exactly.
Yeah.
Whether it's good information or not, they already know. So it's better if it comes from the right person, who is their mom.
Exactly.
I agree. I think that's a really great segue to some of these questions. And I'm hoping that there were questions that I also was curious about too. So I'm excited to kind of get into these questions and talk about. So I think Naomi was kind of talking about the teenage years, like the timing of which you would start kind of initiating those types of conversations. So one of the questions that I had was, when is the right time to discuss contraceptives, with your doctor, with your children, with your mom? When does that happen? What does that look like?
Mm-hmm. And I honestly thought that was a great question. When is the right time to start discussing about contraceptives? So I know, Naomi, you talked about like when your daughters get to teenage years, and that's when we'll talk about it. And I like that answer. But also, I think the short answer to that question is the right time is when you feel like you need to talk about it with your daughters. Okay. And also in consultation with your doctor, and your doctor can advise you like when is the right time. However, as a medical student who is learning about these things, the simple, again, I'm not giving medical advices here, but my opinion of this is some people can start having their menstrual period as early as 8 years old. That is not even a teenager, right? But they are mature enough to conceive and become and carry pregnancy and give birth to a child. So for me, I would say, as a mom who has girls, maybe you can start learning about these things, especially for people like Naomi and I who didn't have that education growing up. I think it's important for girls to learn about this. And hey, you can come to my channel, so share this video. I think it's important for girls to learn about this as early as they can.
Okay.
Because if you have a daughter who like starts their menstrual period when they're 8, they're a baby at 8 years.
Those are babies.
But biologically mature enough to conceive. So I think that's the time to like go to your doctor and say, hey, when is the right time to do this? And again, girls don't have to go on contraceptives when they start their periods, right? Because for me personally, of course, as a medical student and also as a Christian, right? Because this is a Christian-based channel, it's because I feel like the first education we should put out there, it's like safe sexual practice, I guess. And when we're talking in terms of birth control, the safest contraceptives out there is like abstinence. Yeah, because I remember in our first video, Naomi and I talked about stages of bonding. And here's the link, you can click on that. Or we talked about stages of bonding, and we talked about how when engaging in intimacy and sexual intercourse, there's a hormone that gets released, especially in women, and it's called oxytocin. And that hormone, like, it's a bonding hormone. So you feel attached to the person you're getting intimate with. And with that, then it prevents someone from making good judgment about their partner. And that's why majority of us, like you make those mistakes, you engage in intimacy, it bars your judgment, and then you end up wasting time with a person who is not right for you, know? So of course, in terms of birth control, abstinence is the best. But of course, we have to be realistic. They're human beings, people have hormones, you get yourself in situations like you talked about rape. And most of the rape cases happen between people you actually know, like your friends, which is the unfortunate part. So the right time, again, to talk about contraceptives, I would say in terms of birth control, it's when somebody starts their menstrual period, and also in consultation with your doctor, then they can help you make that decision. And I know lots of primary care physicians or gynecologists, they'll be more than happy to talk to you and your daughter together,
That's a good thing.
Go ahead.
I was just going to say, Lydia, well, I want you to finish your point, but something that you hit on talking about that I think sometimes you associate like the menstrual cycle, like starting, maybe when you're a teenager or something like that. But that was news to me that, a young girl as early as 8 could experience her first menstrual cycle. So I wonder if it's worth talking about like the menstrual cycle itself, like what it is to get your period, and how maybe these two topics are connected, but sometimes maybe they're not, depending on the number that might have experienced their first menstrual cycle.
Exactly. No, I like that point and I like that question. Yes. So again, contraceptives can be used as birth control, and that is directly connected to the menstrual cycle. And thank you for bringing it up. I'm going to briefly talk about the menstrual cycle because we cannot understand contraceptives if we do not understand the menstrual cycle. So when I talk about the menstrual cycle, I know it varies among females. Some have their menstrues every 21 days or 28 or 32 or 40, it varies. But for a standard patient, or the one we are taught on our textbooks, is the menstrual cycle lasts for 28 days, and it's divided into 2 phases. So we have day 1 to day 14. And this is, in a layman's term, I'll call it the growth phase, where things are like growing and the hormones, the chemicals in your body are regulating that stage. So the growth, so the inner lining of your uterus is growing. And really, because the biology is to prepare your womb or your uterus for a potential baby, because that's biologically speaking, that's the purpose of the menstrual cycle. And then the last half, day 14 to day 28, in a layman's term, I'll call it the secretory phase. I guess the phase where things are getting secreted to maintain what grew on the first 14 days. Does that make sense?
That makes sense.
Okay, because I don't want to confuse people. This is a topic that is taught in medical school, like in an hour lecture, and there's a whole year fellowship about the menstrual cycle. So it's not something we can exhaust now. But just to summarize again, day 1 to 14 is the growth phase. Day 14 to 28 is like the maintenance or the maturing phase and secretory phase. Things are secreted to maintain the growth. And so these phases are controlled by the hormones. So I know some girls out there are taking pills that they have progesterone or estrogen. I know those names are out there. And so these are the hormones that your doctors are trying to play around with to help control that specific cycle, the menstrual cycle. So the menstrual cycle is a cycle. It begins and ends where it started, right? That's the circle. You begin and end where it started. So it begins with the menses and ends with the menses. And the menses is that time of the month where women shed the inner lining of their uterus or of their womb, and that is what we call the endometrium. Again, I talked about it in my previous video on endometriosis, and you can click this link over here so to learn more about the inner lining of the uterus. So it happens to women depending on the length of their cycle, but at least 1 month if you're going by the 28-day cycle. So during the menses, we shed the inner lining of our uterus. And so that's that's the end of the cycle and also the beginning. Okay. So day 1 to 14, then your brain releases chemicals that they go to your womb and your uterus, and they tell it to start growing, to start building up the lining that was shed. So you're building it up so it can prepare in case a baby is conceived. And then on day 14, we have what we call ovulation. So ovulation, I wish I had an egg. It's like when you want to use an egg, it has the eggshell and then the egg is inside. Sometimes you take a spoon and you want to crack it so you can open, right? So if you think of the spoon as one of the chemicals that the brain releases to help with ovulation, so it's like you knock it, so the hormone goes and tells the eggs in your ovary, like, hey, open up and release the egg. So when the egg is released, that is what we call ovulation. So the egg comes from the ovaries, which are on either side of the lower part of your stomach. And so using contractions, then the egg is pushed towards the uterus in the middle, your womb, and then it's released down. So that's what we call ovulation. And if fertilization does not take place, if somebody does not engage in sexual intercourse and the sperm does not find its way in the uterus, then the egg is just released. And some women usually experience pain during ovulation, and it's because of the contractions, like the forces that are pushing the egg towards the uterus. Okay. And yeah, that pain is called metal schemas. I don't even know how to pronounce it. I'm going to write it here so people can see, which I should know how to pronounce it. But yeah, some women experience, like, it can be painful, and it's usually on one side. So if you're having those pains every month, don't get so concerned. But if you feel like it's different, again, I always encourage people to go see a doctor. If you notice any change, go see a doctor. But sometimes it's benign, meaning it's not like something bad. It's just your body trying to get rid of the egg or to push it towards the uterus.
Wow.
And if fertilization does take place, so the sperm meets the egg, and then you conceive and a baby is formed. So then the we call it zygote. So then it will like implant in your womb, and that's where the baby will grow. Okay.
Wow.
So all that process is controlled by hormones. And so it's when doctors get a very good understanding of that process, then they can give you medication or injections to regulate that process. Does that make sense?
Wow.
No, really, I think I just learned more from you, Lydia, than I did in any of my like sexual education classes or the conversations I've had. So I appreciate the very understandable version of that cycle and understanding. Like, I think the point that resonated with me is just like the menstrual cycle, it starts where it ends. And all the things that your body goes through over the course of those 28 days, and just being able to understand, like, you having, the bleeding and things like that, that's just like one piece of it. It made a lot of sense. Thank you.
Bree, I agree. I agree, Bree. Oh my goodness, I'm so overwhelmed. Like, I can't even imagine. I agree, especially when she was explaining from day 1 to 14 what goes on, and 14 and up until 28. Honestly speaking, it made me realize for sure a lot of us women out there, we go through our menstrual cycle, but we don't really know what's going on in our bodies, for sure.
Oh, so yeah. 100%.
This was very informative, Lydia. Thank you.
Thank you.
Yeah. I love you, my sister. Thank you. Thank you so much. You are my support system. Thank you for that encouragement. I was worried that I'm going to confuse with lots of explanations, but I'm glad it made sense.
No.
Good. Okay.
So Lydia, I wonder then, I think you hinted at it a little bit with your earlier response, but, are there safe contraceptives? If so, what are they? If not, why? And I think you kind of talked about the safest route is abstinence altogether. But as Naomi mentioned, there can be circumstances outside of our control where things happen to us. And so do you want to touch on, to expand upon, the idea of what's safe? If so, if there are any ones that are safe, if not, why? Do you want to expand on that anymore?
Yeah, sure. That's a good question. So of course I have to put it out there too. Like, safety is a relative term, because so long as you're putting anything in your body that is not usually there, your body might react in a way that nobody can predict, right? So those are the things we call side effects, like how your body reacts to those foreign things you put in you. So yes, the safest way, if you're talking in terms of birth control, it's abstinence. But of course, being practical, in fact, the average age that people start engaging in sexual intercourse is 17. So it's a topic we need to talk about. Now, I'll start with the shortest and quick. The permanent way to achieve like birth control is surgery, right? So for women, they can go through different types of surgery. There's something they call Tubal Ligation, and that is when women talk about their tubes are tied. So I wish I had an image. So we have the womb right here, and then, or let's say I am the womb, okay, and then my hands are tubes. Okay, imagine I am the womb, my chest is the womb, whatever. My hands are the tubes, they call fallopian tube, and then my hands here are the ovary. So this is where the egg usually is. And then when I talked about the contraction, they usually move this way and then they come here to the womb, okay? So with surgical contraceptives, they can either take away my arms completely. So
the fallopian tubes.
Yeah, they take away the tubes completely. And that procedure is called salpingectomy. So they just take it out, and that means you're not going to have eggs and they will not travel. And so even if you engage in sexual intercourse, you will never get pregnant. So that is removal. The other thing is the tubal ligation, where they tie your tubes. So remember, this is where the egg is, and these are the tubes where it travels through. So they can tie it. And that means even if you release eggs, they're not going to get to your womb. And so
can that fail if they don't tie it well?
See, so, and of course, for me, it's a biased answer. Anything that is not God given is not perfect.
Okay.
But these methods are like 99% effective.
Okay.
So it's like very slim chances you will get. But of course, even medical professionals themselves, you can never say never. Human beings are not textbooks. Some people will surprise you.
Yes.
Okay. So that's one. It's called tubal ligation. And the other part is like hysterectomy. They can just take out your womb entirely. And it can be partial hysterectomy, where they take your womb and then they leave your tubes and your ovary. So that's because you know why they choose to do that. So if they take out your womb and they leave the tubes and the ovaries, remember these ovaries here, they also release the chemicals, the hormones that regulate your body. So sometimes they conserve this so that you don't have hormonal imbalance. Think about it. Women who are in their menopause, you know how they get hot flashes because their eggs are done, like they don't have any more eggs, so they are not producing those hormones, and so that's why they have mood swings. They feel hot. So sometimes when the doctors choose to do a hysterectomy to take out your womb, they can preserve your hormones.
Awesome. Well, Lydia, I think that this is super informative and very, very valuable. And I think this kind of explanation and even your visual is something that, we don't always get. We don't know where to go to look for this information. Maybe we don't have an access to a doctor, or we don't quite feel comfortable enough to go and talk to a doctor just yet. So appreciate the opportunity to kind of ask these questions. We do have a few more, but definitely want to wrap up this video, allow you to kind of close it out. And then obviously, give individuals the opportunity to stay tuned for part 2 of this conversation, because there's a lot of great information to come. So.
Okay, sounds good. Thank you so much. Yeah, I guess we'll be right back. And guys, before you watch the next video, if you like this video, please give it a thumbs up. And also please subscribe if you have not subscribed, and share with your friends.
The subscribe button.
There you go, Naomi.
Hit the subscribe button.
All right, guys, we'll be right back.